Welcome to the fourth video in our series on participatory, community-engaged evaluation. In earlier videos, we discussed authentic engagement of and collaboration with program participants and community members, building trust and relationships, and co-designing and co-leading evaluations as described by Children's Bureau discretionary grant recipients and their project partners. Here, we focus on the final building block, sharing and interpreting data with program participants and community members to understand and improve programs and services.
What we know about how people communicate is that often it's more symbolic, or there's deeper meanings associated with what people are trying to tell you. And someone's story doesn't necessarily always articulate that in a really direct way. So in addition to collecting those stories, we ask the people giving us those stories to also answer a few questions about what that means to them. And then that serves as a data set for us to go into local communities and engage a group of people who actually live in each of the communities in conversations around, here's stories that are coming out of your community. This is what people are saying. Help us interpret what the meaning is here. Help us understand what's happening in a community level and what they're actually trying to communicate when they give us these stories.
We also use those opportunities to share back with parents findings that were coming. We had monthly reports that we shared back with VCR, but also with the parents who were involved so that they were up to date on what was happening, what we were learning, where we were going, so they could continually provide us with great advice, great guidance. And we also had that measure of accountability and transparency.
And so when they do look at information or data that might be contrary to a certain perspective, or you're getting conflicting sort of perspectives, the end goal is to come to some consensus about how to use the data in a better way to advance practice to better address the needs of families. I think that people came together because there was trust and because there was an authentic and genuine effort to try to make things better for families in that community. And when you have that commonality, is then people don't get defensive when you're having frank conversations and when you're looking at data, and then keeping in mind that sometimes data can be interpreted in many different ways.
Dr. Perry would have us come together. We do almost like a focus group, and he would ask us questions and we would give him feedback. And it was really good feedback. Some of the things I wasn't sure that I was paying attention to until he started asking me questions. I'm like, wow, that was really going on. And then I got actually involved in everything that he was asking. But I thought I was really there just to listen and observe. And I actually was able to give some good feedback.
To just be able to sit down amongst so many different people, different ages with different obstacles, different life experiences, and come together to create something so unique yet so powerful, and just to create that directive that we know is successful because we look around us and you can see the growth of our community. You can actually see where those reports and just those action plans are actions in work.
I didn't realize I was collecting more information than I realized. And Jessica had to coach me that the little things and many times that the time that I spend with the parents is valuable data. I thought it was insignificant data, but she let me realize that those little insignificant things were big things in terms of working with parents and making a difference. And even time accepting a phone call late and didn't realize that parent could be in tears and just needed some direction.
They help us understand contextual pieces that we wouldn't know from the seats from our vantage point and where we're at. It's become our preferred and desired approach is, yep, we've got the data, we've done our analysis, we've visualized it in some way. Let's take those visuals and talk about it with folks. And it's in every single case that we've done that, it's returned a better interpretation than we would have done on our own.
It kept us from staff from getting defensive when you saw numbers that necessarily weren't going the way you wanted them to go. Because they were able to say, well, look at it from this perspective. So that I think that really helped. And so we looked at the numbers, and the team looked at the numbers, not just from the good, but also from the numbers that may not have been trending the way we want them to trend.
That's really been paramount to this evaluation, because truthfully, I can say as the lead evaluator, what I might have extracted or pulled from those stories is not what we heard necessarily in the communities. I don't live in that community. I don't have the daily interactions in that community. I would, I can make some assumptions or inferences about what I'm seeing there, but in a lot of ways, those conversations end up helping kind of, turn our assumptions on upside down to some extent, and really it puts it back on what is this community's voice.
Some of the programs we may have already had, but some of them were the result of feedback from community members. And I think they were really interesting results, because we saw, I think, some things that were unique to the sites, but we definitely saw themes as well. Some gaps in services, such as fatherhood initiatives or the parents or community advisory councils. So it really led us to developing the action plan, which again, I think helped us with the community trust, because we weren't just gathering their information, compiling it in a report and letting it sit there. The whole idea was we were going to take the information, we were going to refine, and we're going to get better, and we're going to continue to do that.
We have a patron feedback survey that we ask our patrons to complete upon receiving services. We really, really value what we receive through those surveys. We also have this with our community partners, surveys that help us learn what we need to do to get better, what we need to do so that we're mirroring what the community's needing at any given moment.
We have a way of speaking about this work, the terminology that we use, the methods that we use, that can be off-putting and not really accessible for everyone, even those that we call professionals. And the CQI component of the evaluation was really built based on the grant activities and strategies that were outlined in the theory of change and the logic model. It was designed to closely monitor initial implementation of the key grant strategies in order to identify mid-course corrections that needed to happen throughout. So the outputs and proximal outcomes that were outlined in the logic model were used to determine the questions that needed to be answered. And we were able to engage the parent advisory board, the community members, folks from DCBS in that process.
The family resource centers are in a constant loop of continuous quality improvement. I have learned this through the research. It is just being in the family resource centers, talking to patrons. It's always what can we do better? It's always what do patrons have to say?